So this data was phase 2 data of Copanlisib, which is the Bayer class 1 PI3 kinase inhibitor. Preferential activity inhibiting the alpha and delta isoforms, and this trial was developed on the back of the phase 1 data, which was showing interesting activity, particularly in non-Hodgkin's lymphoma. So the data we presented was the phase 2. We had recruitment from both indolent and aggressive lymphoma patients in the relapsed refractory setting. So these patients were really quite tough. They'd had at least 2 lines of prior therapy, even up to 10 prior lines, and were spread across the age range. It's hard to imagine, but the oldest patient in the trial was 90, and so this was truly representative of how difficult it can be with patients in the relapsed refractory setting. The drug is quite well tolerated. It's given IV on this schedule, so intravenously on day 1, 8 and 15, so that's 3 doses every 4 weeks. And there are toxicities, but generally fairly well managed. It's interesting, probably because of an effect with PI3 kinase alpha inhibition, that the insulin homeostasis is disturbed. So patients can quite commonly get a rise in their glucose levels on the day of an infusion, but this doesn't usually turn out to be something too troublesome, and it's easily managed. There have been other readouts, hypertension, that's something that's required treatment in some patients, but again, not too bad. And a small signal with pneumonia, pneumonitis, which is something that just has to be kept an eye on. But in terms of response rates, well, the data was quite impressive, particularly for indolent lymphomas with across the board of different pathologies showing a good response rate. And actually 3 complete remissions were seen in the follicular lymphoma cohort that was evaluable. So that's certainly encouraging to take forward. So as things stand, the data is looking good. It's all, of course, hypothesis generating and pushing forward to the next trials, and Bayer are currently extending recruitment for the phase 2 component in the indolent lymphoma. So we're busily recruiting, and Cambridge are recruiting, as well as other centres across the UK and internationally. And then the company have a plan to extend the program with this drug to include randomized trials with or without rituximab, and as you'd expect, taking the drug forward in different directions, including actually in the aggressive lymphomas. Well, of course, next in the world of indolent lymphoma, we're moving into an age of combination therapies, really, where these drugs, things like this as a PI3 kinase inhibitor, but other inhibitors of different aspects of signaling pathways, they're all going to be combined with different antibodies, potentially different chemotherapies as well, really to push those remissions deeper, to give our patients better and more durable remissions going forward. Oh, I think it's positive. Of course, the space is quite crowded because there are drugs there already. There's Copanlisib, which has already got license approval for relapsed refractory indolent lymphoma. And there are other PI3 kinase inhibitors as well. There's the drug from Infinity, TG Therapeutics have got one in development, Amgen have got drugs in development. So it is quite a crowded space, and I think that's triggering a lot of the debate. Where will these individual compounds sit? But as I always say, it's better to have a cupboard full of choices that you can bring together, because each drug is looking a bit different. They've got different side effect profiles, probably have different specific activity with disease groups. So going forward, the space is crowded, which is great, but clever trial design, and let's get these drugs through to our patients. Well, my message is, everyone who's listening, you know, the world is changing for lymphoma and CLL. It's a tremendously exciting time for clinicians and those of us running clinical trials. And of course, we're all hoping so much that our patients, going forward, we're doing everything here for our patients, that their outlook in the near future is going to be better than historically it has been.